Today we're going to talk about accessing porta-cats. Remember, the first thing that we do is maintain a clean environment, wash our hands first, and use gloves. Okay, this gentleman's got a porta-cat right here inserted under the skin by a surgeon. This is a IV access that is a lifeline to these patients. Whenever they have them and they come in, I like to ask them first, would you mind if we accessed your porta-cat? Because like I said, it is a lifeline to them. And I have some respect for them also. I just like to clean the area off with alcohol first. That's not totally necessary, but it's a good extra thing. We have these kits in the our supplies that do have some of the materials that we need. There's the large tegaderm that you need for the after you have everything accessed. There is the ChloraPrep, or you could put your own together and use the little betadine swabs as well. You're going to need a gripper needle, which is this like little IV piggyback type thing here, pigtail thing here. It has the two ports on there. It's a regular cap. You're going to switch this over to our blue safety caps. So it is just like using a regular IV. You're going to prime this line first because it's quite a bit larger than most. And you're going to just prime it with a little bit of saline first. Okay. And then we're all ready to go. Now, like I said, we could either use this. When you're cleaning the patient, you're going to start in the center and go in a circular motion. And I'm going to use the betadine also, because that way you'll be able to see that, because it leaves a little bit of the orange. Circular motion. Let that dry just for a few seconds. These gripper needles are 19 gauge usually. They have the little stopcocks on them here. And then you're going to go directly down. Think of it as a doorbell, because it's about the size of a doorbell. And you're going to just put this needle directly down into the skin. 1, 2, 3. And that's access. This is a handle to hold on to that. Don't take that off until you know your placement is confirmed. Placement's confirmed by seeing if you have a blood return. And we're going to get a waist. So we got a very good blood return. I would get at least the whole blue top tube, because these are flushed with a heparin lock flush after they're accessed, and then when they disconnect it, you flush it with heparin lock flush and then discontinue that. So you have to get a good waist, especially if you're getting labs. Okay, very good here. And then when you flush these ports, you need at least 10 cc's to flush it with each time, because it is a little bigger. And you're going to clamp off these two little clamps. Here, unbox it. Okay, you take off this little handle there, and it is a little more flat, so you can put this on your large tegaderm. Positioning it could be just a little tricky because it's sticky and you have gloves on. Here we go. Voila. And how are you doing?
Going.
I didn't hurt you too much today?
No.
All right, thank you very much.
You're welcome.